Locality planning arrangements within children's services in Moray have been in place since 2018. This short film explains what locality planning currently looks like in Moray, the improvements we're putting in place, and what this means for you, your organisation, and the children and families you support.
So what do we mean by locality planning in children's services? Locality planning is about organisations working together with people and communities to ensure we collectively deliver the supports and services children, young people and families need in a way that works for and with them. It's about listening to children, families, communities and frontline practitioners to find out what's working well, what makes it effective. Can we collectively deliver supports and services in a more effective and efficient way? Are children, families and practitioners telling us that services are disconnected? Are we being asked to jump through too many hoops to access or offer the support required? If so, what do we need to do to address these issues? It's also about maximising opportunities for us to all work collaboratively, to notice emerging trends and spot and address gaps in provision. We can rarely do this well as a single organisation. It requires us to pool our collective knowledge, resources and expertise to creatively co-develop solutions which make a real difference to children and families, reconnecting us all into the communities of place and identity in which we live, work and play. Examples of this include organisations working together to address where we've spotted increased incidence of alcohol use amongst young people, or if there's a rise in parents of young children feeling socially isolated and struggling to cope. Perhaps lack of supports during school holiday periods for children with autism, especially in rural communities. Sometimes, as a single organisation, the temptation is to create a new service to fix the problem, but often this is only a sticking plaster. Collectively, we can identify and build on strengths to reconnect people into their own communities, facilitating their participation in community life, such as facilitating access to learning and sources of support, whilst remembering to respect the choices of individuals.
As Ailey has explained, our current locality planning model has focused on making improvements within localities. It hasn't been about responding to individual needs of families. We currently have two locality management groups, East and West, usually referred to as LMGs. They're made up of managers from across all services who have the authority to deploy their staff or resources to the best effect. They currently share intelligence, themes and issues from a single organisation perspective. This includes actively seeking the views of children, families and communities, agreeing priorities on a partnership basis and identifying solutions. These solutions are then implemented through the locality networks. A co-production approach is adopted at all times. This isn't about doing to families, it's about developing and implementing solutions with children, families and communities. Currently, the LMGs report directly to the GERFIC Leadership Group, which is made up of heads of service from across the Children's Services Partnership. Issues which cannot be resolved by LMGs are escalated to the GERFIC Leadership Group. As part of the COVID-19 pandemic, it was recognised that the existing locality planning arrangements were unable to respond quickly to the escalating individual wellbeing needs of children and families. The further development of locality planning processes was therefore prioritised to ensure that children's services across Moray could rapidly and effectively plan together to support children and families, focusing on early intervention. A partnership response was developed based on the GERFIC staged intervention process. 4 multi-agency connect teams were established, and their function was to review the needs of children, young people and families referred to them by the named person, share their knowledge of supports available within the locality and help to make connections with these supports. In situations where the needs were more complex, similar support was provided by the multi-agency support hub known as MASH. MASH is made up of representatives from across all agencies who have the authority to direct their resources within localities. Collectively, the two locality planning processes have provided a coordinated partnership approach to identify and address the wellbeing needs of local communities, as well as individual children and young people. Following the initial lockdown period, both of these locality planning processes have been in existence. However, not all elements have been fully operational due to capacity issues. A robust evaluation of both models and learning from national best practice has helped shape a combined, streamlined locality planning model, which we plan to pilot for an 18-month period.
Let me take you through the remit of each of the groupings within the revised model. Our locality networks, first of all, they will focus on improving outcomes for children and young people, and they'll do that through better collaboration at a local level. Made up of frontline managers from the public sector, third sector and community organisations, they have a similar remit to the locality management groups and locality networks in our existing model. For example, they share emerging issues and intelligence from a single organisation perspective and try to develop a partnership solution. They will have a clear focus on early intervention and prevention, and crucially on building community capacity. The partnership with our third sector and community colleagues will be strengthened, and a clear focus on co-producing solutions with children and families will remain. During this pilot period, we'll operate two networks on an east and west basis. However, they will retain a locality focus. This approach has been adopted as we recognise the majority of managers have a wide geographic remit, and we want to minimise the amount of time in meetings and maximise the time spent on developing solutions. The locality networks will report trends, themes, solutions that are being developed and impact to the Wellbeing Partnership Group. They will also escalate issues that require decision making at a more strategic level. This includes gaps in provision. Our multi-agency support hub, known as MASH, will operate on a Moray-wide basis and will retain its previous remit to respond to the individual needs of children, young people and families. It will be made up of managers from health, education, social work and third sector services, as well as commissioned services and the police. It will meet every 2 weeks to look at the needs of families who are referred, who might benefit from an early intervention based on a multi-service, multi-agency response. With their consent, families' needs will be reviewed, and members, both individually and collectively, will identify whether they can provide support and act accordingly. For example, this is not a signposting service. Additional agencies will be invited on an as-needs basis. For example, colleagues from housing or adult mental health services may sometimes be called upon to take part in the discussion. The existing child's planning processes will remain in place. In addition, we're recruiting 2 network coordinators. They will provide an advice and support service to named persons and bring more complex cases to MASH for support. The multi-agency support hub will also report actions taken and impacts to the Wellbeing Partnership Group, as well as gaps in provision. They will report themes to the networks so that they can develop locality solutions. The Wellbeing Partnership Group, this is a strategic group made up of senior managers across all sectors. They address the themes and trends coming from the networks and the multi-agency support hub by either reallocating their own resources or levering in additional resources through partnership funding bids based on evidence of need provided by the networks and MASH. They will also collate and continually review additional data and intelligence available from across all agencies, which relates to the wellbeing of children and families. All of this is intended to support children meeting their developmental milestones. They will take appropriate action at strategic level, or where more appropriate, link with the networks to develop locality-based solutions. This group also has strategic responsibility for the wellbeing priority within the Children's Services Plan. Based on local evidence and extensive consultation with children and young people, there are 3 key areas of improvement: improving the mental, physical and social wellbeing of children and young people. They will link directly with the networks to develop and test improvements. The Wellbeing Partnership Group will provide summary reports on progress to the GIRFEC Leadership Group. This will include gaps in provision where there is a requirement to either commission a service or reallocate resources at strategic level. The GIRFEC Leadership Group has the overarching responsibility for the whole Children's Services Plan and for ensuring appropriate linkages are made to other relevant strategies. Each group has a quality assurance responsibility, and in addition, an external evaluation will be undertaken of this pilot so that we can make informed decisions about how to progress after the 18-month pilot period.
Benefits of you and your agency's involvement. We've heard about the structure of the revised locality planning model and a bit about the work that each element does in relation to children, young people and families at local areas in Moray. We're now going to think about the everyday challenges that we as individuals and organisations face and the opportunities that this new locality planning model will offer to help address them. Many of us who work to improve life for those in our local communities know the pressures that come from working in an environment where demand for our services outstrips the resource that we have available to meet it. And whilst we understand how intervening early to address a problem has the best chance of solving it, in reality, the scale of the issues that come to us means that increasingly our limited resource is drawn into crisis management. People work harder to do more with less, and over time it becomes increasingly difficult to meet our single agency responsibilities and priorities. Sadly, the frustration and stresses of these pressures lead to what we commonly refer to as burnout in individuals, teams and organisations. In particular, we know that if we fail to identify, plan and adequately meet the needs of children, young people and families when they first arise, it leads to an increased demand on a range of youth and then adult services. So how does this revised locality planning model help us interrupt this cycle and make the best use of the resources that we have available to us? As the presentation shows, the revised model recognises the power and importance of making connections. Taking a multi-agency approach lets us develop a shared vision for the local area and ensure that priorities are based on local information. By making connections, we're able to understand what other groups are doing and planning in the locality, make links with them and work flexibly so that the systems we work with are able to be responsive to change. Working collegiately, this means that we are equal partners in terms of developing services to meet need. Members of the network will have a shared responsibility for informing their own organisations or their own service areas of the locality aims and the part that they're able to play in progressing the agreed priorities. Extending this connectivity with links to MASH and the Wellbeing Partnership Groups will bring cohesion and accountability to the process. Locality planning means that we have many heads and many minds focusing on how to best deliver improved outcomes for children, young people and families and our local communities. Working together means that from our collective knowledge gathered from the lived experiences of children, young people and families and our organisational data, we can proactively plan and share resources to meet the real needs in an informed and relevant way within our locality networks. We will also be able to identify trends and patterns of unmet and emergent need and share this with the Strategic Wellbeing Partnership Group, so ensuring strategic planning and resource allocation is well informed and effective. In addition to promoting informed and responsive planning, the revised locality planning model facilitates the sharing and, where appropriate, the pooling of our resources. Working as partners in a locality means we can develop shared priorities. We can identify issues for joint action and agree together on what we are trying to achieve. This united voice will give clearer direction to the allocation of resources and allow us to see where there are gaps in services. From this will come opportunities for the co-production of action plans, meaning that children and young people and their families and partners are all involved in the development and evaluation of the locality model and its work. The data we gather will also allow us to identify what's working well, evaluate it and build on it so that others can share and benefit from it across Moray. As the saying goes, many hands make light work, and whilst planning and working together to improve outcomes for all has challenges, in the light of this revised planning model and the way that it will work together, the benefits it can bring to all involved will outweigh the challenges.
So as part of the Moray Community Planning Partnership, we now want to explain a little bit about what the involvement is and what it means for you as a practitioner. So by being an active participant in one of the groups, you'll find this will also help meet your single agency objectives. We don't have every member of your team or department on each group, so it's about how you use your organisation structures and processes to feedback and bring the right members of your organisation on board to address specific issues or needs. It's also a great opportunity to share knowledge, expertise and resources to meet common needs. It's not necessarily about you adding to your current workload. It's about how we as a group can work together to gain a better understanding of what we all offer, how we can work in a more coordinated and creative way while also reducing bureaucracy and avoiding duplication. So really, you might be asked to contribute to monitor and evaluate the support that you're offering, but at the end of the day, it's about everybody working together.
This exciting opportunity will start shortly and we'll be keeping you updated on progress. Throughout the life of the pilot, we'll be seeking your views on how it's working for you and the children and families you support. In the meantime, if you need any further information, please don't hesitate to contact us.